Good noon, I'm Ithea Francesca Murillo, your student nurse from Davao Doctors College, BSN 11K, Group 43, and today I will be demonstrating the assessment of the abdomen. So, for the pre-introductory phase, the first step that we need to do is to review the medical history of the client if available, and also the doctor's order sheet. So, what I have here right now, the only thing available is the doctor order sheet. So, as per checking, the what's stated here is the client needs to be assessed on 1 p.m. and the client is sensitive to cold temperature. So, the rationale behind this is for us to know and for us to have a guide before the assessment. And the next step also is to prepare your equipment. So what I have here on my left is the equipment needed for the assessment of the abdomen. What I have here are the alcohol, tape measure, a marker, and the doctor's order sheets. So the reason for this, it helps us to reduce the risk of error. And aside from preparing the equipment, you have to also do the hand hygiene. So what I have here right now is an alcohol. So that's basically it for the pre-introductory phase of the assessment in the abdomen. So for the introductory phase, the steps that we needed to do is to greet the client politely, and if there's any companion around, greet them too. And also introduce yourself and verify the client's identity using the wristband on your client. And aside from that, you have to ask the client how he or she want to be called during the assessment, and you also have to build rapport. Aside from that, you have to explain the procedure to the client and ask him or her if there's any questions that he or she would like to clarify. And also, after that, you have to ensure the client's safety and comfort. It can be by closing the door, the windows, and make sure the client is comfortable in the bed, or it can be on the chair. So basically, that's it. But on the last part, make sure the client has emptied his or her bladder before the assessment. Hi, sir. Good noon. I'm Ithea Francesca Murillo, your nurse for today. May I know your name? Okay. What do you want me to call you?
Franco.
Okay, Sir Franco. Are you nervous?
No.
Okay, that's good to hear. So, what I will be doing later on is I will be assessing your abdomen to make sure that there's nothing wrong. And hopefully, there is nothing wrong. But if there is, it can be treated immediately. And you can participate in this assessment with just your cooperation. Any questions regarding the assessment?
No.
Okay. Also, to ensure your comfort, I already warmed up the place. I checked with the order sheet of the doctor that you're sensitive to cold. Am I right?
Yes.
Okay. And this is strictly confidential, sir. I will close your windows to ensure privacy. So I would like to confirm that you already emptied your bladder.
Yes.
Okay, that's good to hear. Thank you so much. So for the working phase, these are the steps that you needed to do first. Position the client in a supine position and cover the upper and lower part of the body with the bed sheet, and let the abdominal be exposed, and observe the abdominal skin for stretch marks, visible veins, and scars, or it can be rashes. If there are scars, you have to document them by its location of the quadrant. And the last part for surveying the abdomen is to inspect the umbilicus. So umbilicus is also known as the belly button. So you have to inspect it for its color, contour, and location. So these are the steps for examining the abdominal inspection. So the first step that we're going to do is to inspect the abdomen for contour and symmetry. It can be flat, scaphoid, and distended. Aside from that, you have to inspect the area between the lower rib and the pubic bone, and note for any enlargement. By doing so, you have to use the tape measure and measure the abdominal girth, and you have to do it at the same every day for the same time. I'm going to check for the contour and symmetry of your abdomen.
Okay.
So far, sir, it's flat, which is normal. The next step is I'm going to measure your abdomen, abdominal girth, starting from the umbilicus. These are a clean tape measure which is disposable. So starting from the umbilicus, from the this this um, will be thrown after our assessment. And also, for the reminders, I already reminded myself about that, so there's no need to worry. Also, a few things to remember. Your client should have emptied his or her bladder. Second, the client should be in a supine position with his head slightly elevated due to the pillow that we put on under the neck. And the third is to use a clean tape measure or a disposable one. Fourth is to start measuring on the belly button or the umbilicus going at the back. And fifth is to record in centimeters or inches for the documentation. And sixth is you have to measure it at the same time and same side. 7. Inform the patient to not remove the markings. Hello, sir. I will be inspecting your abdomen. So I want you to. I will put you in a supine position, sir. That's great. And okay, thank you for your cooperation. So I will check for any rashes, stretch marks, scars, or any veins that is particularly showing. So as I can see, there's no scars on your abdomen, there's no rashes, everything is perfect. For your umbilical, the color is normal, the contour is normal, and Yeah, it's all normal. Thank you so much for your cooperation, sir. Hello, sir. So I'm here to check for the peristaltic waves. So can you please take a deep breath for me? Say again. Thank you so much for that. The next step is to auscultate the abdomen for vascular sounds, bowel sounds, and also peritoneal friction rubs. Next step after that is to use the flat disc diaphragm. And the reason for this, intestinal sounds are usually high pitched and best accentuated by the diaphragm. And the next step is to ask the client when he or she last ate. The reason for this because shortly or long after eating, bowel sounds may normally increase. Hello, sir. So for today, I will be checking your abdomen, basically auscultating it. And no worries, sir, because the stethoscope have been worn because on the doctor's order sheet you mentioned that you are sensitive to the cold, right? Okay, so I'm going to check now, starting on the right lower quadrant and count and clockwise. And you should listen to each quadrant for at least 1 minute. Check for any vascular sound, high-pitched noise, and such. And document if there's any. Thank you so much for your cooperation, sir. The next step is to percuss several areas in each of the 4 quadrants. So typically, you have to listen to the tympani sound indicating gas in stomach and in the intestines, dullness, decreased absence or flatness of resonance over solid masses or fluid. So when you percuss, you have to use a systematic pattern. Begin at the lower right quadrant, which is here. Proceed to the upper right quadrant and lower left quadrant and to the lower left quadrant. So several areas. It doesn't mean that it's 4 quadrants. It should be like 4 areas. So you have to percuss it here, 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 several, and so on up until you finish on the lower left quadrant. So, sir, I'm going to percuss. So, there is no dullness sound, only tympani. So what we're going to percuss next is for the liver. So when percussing liver, instead of going on the right side, you have to do the opposite side, which is from right to left. And you have to notice the sound from timpani sound going to the dullness. As I have noticed that when I percuss it from right going to the left, instead of I was hearing timpani before, but now I'm hearing dullness, because of that's how usually liver, when you percuss liver, that's usually how liver sound when you percuss it. The next step is you have to percuss the mid clavicular line and percuss it downward. So you have to locate it first. It's on the right chest, the mid clavicular line. So as for percussing the upper border, you will notice a sound from timpani to dullness, which means that there is no complications or such for that particular organ. The next step is to place the left hand fist against the lower right anterior of the rib cage of your client, and use the ulnar side of the right fist and strike the left hand. Note for any tenderness upon percussion. And also, you have to listen to the dull sound when percussing. As I checked, there's only dullness, and that is because of the fluid in the liver. The next step that we're going to percuss is the blunt percussion liver. So the step that we're going to do is place the left hand fist against the lower right anterior rib cage. Use your ulnar side of your fist and strike the left hand, and note for any tenderness upon percussion. When I percuss that area, I only hear dullness, and that is because of the fluid present in that particular area. So the next step is for the blunt percussion. Place the left hand fist on the costovertebral angles and use your right fist to strike the left hand. Okay, so this is to ensure on that kidney part if the client is experiencing any tenderness or any pain. Sir, is there any pain when you felt me striking against her back? No, that's good to hear. Okay, you may now lay down. Thank you for your cooperation. The next step is palpation. So you have to perform palpation first to detect areas of tenderness or muscle guarding, and systematically explore all four quadrants. Ensure that the client's position is appropriate for relaxation of the abdominal muscle, and warm the hands. The reason for warming the hand is cold hands can elicit muscle tension and thus impede palpatory evaluation. So you have to warm your hand first. Next is, after warming your hand, hold the palm of your hand slightly above the client's abdomen with your fingers parallel to the abdomen. So like this. Next is depress the abdominal wall lightly about 1 centimeters to the depth of subcutaneous tissue with the pads of your fingers. Okay, so what we're going to do is move it in a circular motion. After that, note areas of tenderness or superficial pain. Excuse me, sir. Do you experience any pain when I palpated your abdomen?
No.
Okay, no. So, as per asking my client, there was no tenderness or any pain when with the procedure of palpation. Last but not the least, do not forget to document all what you did when assessing the abdomen of the client, such as if there's any tenderness, any scars of the abdomen, and summarize the information obtained during the working phase and discuss findings to the client. Excuse me, sir. So I'm going to discuss the findings based on your abdominal assessment. So far, everything is great. There's no need to worry based on all of your results here. Thank you so much for your cooperation.
Um,
Okay, you have a good day.